Okay, everyone, so we're going to start chapter 21 with our first video. And chapter 21 is all about blood vessels. I may abbreviate this just a little bit, so if I skip a slide, don't worry about it. I did it on purpose. And this first video, we're going to go through the introduction into the first handout. So let's get started. So blood vessels. Here, as we first start, I want you to understand that the creation of blood vessels by our body is done through a process called angiogenesis. Angiogenesis is the growth of new blood vessels, and it is done through hormones and various protein factors. An example of this would be tumor angiogenesis factor, which is a protein that's going to aid in the production of blood vessels. Now, scientists look for ways to sometimes inhibit or promote angiogenesis to help with diseases. So, for example, some types of cancer, not all cancer, but some types of cancer, build their own blood vessels. So the tumor actually grows its own blood vessels, and then those blood vessels are feeding the tumor. And so scientists are looking into angiogenesis to inhibit all that blood vessel growth. And if we can do that, we just starve the tumor and it can't survive. An opposite example of this is sometimes we want to stimulate angiogenesis by promoting blood vessel growth. This could be done with, for example, diseases of the eyeball where there's not enough nutrients getting to the retina and causing blindness. So if we can stimulate blood flow to those regions, it might help with patient care. Okay, so there are three basic, whoa, I went too fast there. There are three basic blood vessels that we need to be aware of, and I'm sure you know arteries and veins. So we have arteries and we have veins. Remember, the definition of an artery is a blood vessel that carries blood away from the heart. Most of the time it's carrying oxygenated blood, but not always. And then the definition of a vein is a blood vessel that carries blood toward the heart. Now, not always, but usually it's carrying deoxygenated blood. Now, arterioles are just small arteries. So arterioles are carrying blood away from the heart toward the body, and they're getting smaller and smaller and smaller. Arterioles are almost microscopic. They become capillaries. Capillaries are microscopic, and that's where all of the nutrient and gas exchange occurs. So we'll talk about capillaries a little bit later in this chapter, but nutrients, waste products, oxygen, glucose, all of those things are actually moved through the capillaries into the cells. Then the blood starts to carry waste products back toward the heart, and it starts with venules, which are just small veins. And then those venules get larger and larger and larger and become veins. They deliver blood back to the heart. Okay, so let's look at blood vessel structure here. And it says arteries, but you're going to see here with our first handout that it's actually more than just arteries. It's going to be arteries and veins. So arteries and veins are going to be our first handout. So we're just going to look at the structure. I know I got to fix this handout because I just have artery structure, but it's really, we could just label it blood vessel structure. And so if we look at the blood vessel structure, here is a typical blood vessel. It's made out of three layers. The first layer is called the tunica interna. The middle layer is the tunica media. And then the outside layer is called the tunica externa. Now, the blood vessel is a hollow tube, and it is going to be able to constrict or vasoconstrict and vasodilate. Now, on the inside, let's work from the inside out. So on the inside, we have this layer called the tunica interna. It's made up of epithelium called endothelium. Endothelium is made up of simple squamous epithelium. They're just flat-like cells that are in a single layer, and they're held on by a basement membrane. What happens in the tunica interna is it allows things to move in and out. This is just one layer of tissue. And so, for example, white blood cells can make their way to the endothelium and then squeeze through, like those macrophages emigrate. They move through the tunica interna and then exit out of the blood vessel. So both arteries and veins have a tunica interna. The middle layer is called the tunica media. Media means middle. And this is where all of the smooth muscle is. Now, this is rather thick in arteries because arteries can vasoconstrict and vasodilate. And it's rather thin in veins. Veins don't have a lot of muscle. They're under a lot of, very low pressure, so they don't really need the same structure, but they still have this layer of muscle. So with this layer of muscle, we can squeeze down and constrict or open up and dilate that blood vessel. Then we have the tunica externa. It's made up of elastic and collagen fibers, so it can stretch, it can accommodate the vasodilation and vasoconstriction of the smooth muscle. And it's just a support system to hold things in place. So it's made up of elastic and collagen fibers. Okay, so this makes up our artery and vein structure. Now we're going to use this structure to talk about the rest of the chapter, and we'll talk about how each of these blood vessels function, both in a similar way and independently from one another. All right, so I'll see you in the next video.